Thanks, Chair. And thanks again to our witnesses here today. Could I go back to something actually for the HSA? It was a comment I think originally came through in a report from Meat Industry Ireland, was the very high level of asymptomatic cases that were turning up in the meat industry versus community. Is that trend still ongoing, or has that changed?
I may, a matter about asymptomatic and testing is a public health matter. It's a HSE, Health Service Executive, which will be able to answer that. I think, as I understand, there's a high level of asymptomatic in a number of these situations, but I think for them, the answer really has to come from public health.
Could I say that as someone in community looking at this, I think this question needs to be answered, because if it is a trend that's ongoing, it suggests that there's a predisposition, possibly of a large number of people in the meat trade who are not susceptible to COVID in terms of symptoms, but are carrying the disease, and I think we should know that. And if it's the case that it has resolved, well, then we could put it down to a testing blip maybe that happened early on with all the frantic. But I think we should arrive at an understanding. It seems bizarre that an industry sector could be a complete outlier in terms of community testing, and I think that's something that the committee should be looking into. With respect to Meat Industry Ireland, could I ask about the proposed 24-hour testing turnaround time? Have you been told that this is actually achievable in the numbers that are going to be required? And secondly, the issues of GDPR, which have come up at this committee before, have these been resolved now? So in other words, we heard about the preeminence of people to the rights of their data. Is this going to preclude factories from being contacted about positive cases?
Thank you, Deputy. I mean, we haven't been given clear indication that results will be achievable in 24 hours, let alone 12 hours. I know there has been public comment that there is a capacity there to do that. Unfortunately, some of the examples in recent times wouldn't suggest that. So it is a priority, particularly when we're going into a lot more screening, testing that will place more pressure in the overall system. So we await to get that confirmation. I know the detail is being worked out by the National Standing Oversight Committee. It is something that we have pointed to, and equally to the situation of making companies at the appropriate point aware of the results also. The individuals will obviously be informed and need to be informed, but a mechanism needs to be found so that the company knows at some point, particularly if there's a positives and there's action they need to take. And Deputy, just one, and I am not a public health representative or authority or anything like it, but in relation to your question on asymptomatic, I mean, and I heard the discussion on it earlier today, I mean, one point that might be made in relation to this is that the tests where this shows up is where there is a mass testing done. Perhaps lots of other testing is done on symptom, but where there's a mass testing done, you are then finding a lot of positives that are asymptomatic, and maybe mass testing isn't done elsewhere or hasn't been done to the same rate elsewhere. But that's just offering a view, absolutely not an expert view.
Okay, thank you. And could I just ask, in terms of probably the HSA and the department also, I think from the last sitting that we had around this issue, and again listening to the unions this morning, I think even Meat Industry Ireland might agree that the accommodation in congregated settings, particularly of migrant workers, is without doubt one of the vectors in terms of disease transmission in the factories. Have we any oversight from the public bodies in terms of looking in the future as to how people who are being brought into the country on work visas, how they should be housed, how they should be segregated, what way they should be treated? And I would just like to congratulate Meat Industry Ireland. From the last day, they gave a commitment, I believe, to meet the unions. They have met that. I hope that will bring some fruitful bearing. But just if maybe HSA want to make a comment regarding the accommodation of migrant workers. Thanks.
As I mentioned earlier, it's not a role we have. We recognise that this is one of the issues, and that's why I think public health would certainly be looking at these factors, both, as I said, in and out of the workplace. And issues around permits, etc., are again a matter for the Department of Enterprise, Trade and Employment, as it is now called.
Can I just say, Mr McGuinness, I understand what you're saying, but I would have thought that the HSA would have some oversight in this issue, despite it being a public health. I think it's very much a safety component within employment, and I would hope that it will be something that you will be bringing strongly to the Health Service Executive and anybody else who has oversight here on public health.
Yes, it certainly is discussed at our different national committees, etc., and it's part of the recommendations that they give, both directly probably to the worker when they discuss with them, but equally to the sector and the other stakeholders involved.
Thank you, Ms McGuinness.